All right. Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. It's 9 o'clock on August 26th. Thank you guys for being here live on the call. We've got some great things happening today and lots to discuss. So we do really appreciate your time and attention this morning as we gear up for AEP. Just keep in mind that there's quite a bit of things changing in the industry for both Medicare and ACA, specifically. So make sure you're paying attention to the emails. These calls, we're going to do our best to bring you the latest so everyone stays compliant and has the best opportunity to be successful this AEP and open enrollment coming up. So congratulations to you guys that are being here on this call, because those that are engaged are the ones that get it early and are going to be the smartest kids in the classroom. So we appreciate that. We are here to improve the lives of our community with affordable healthcare. So thank you for being a part of that mission. Also keep in mind that throughout AEP, we're going to host these calls. And I do know that some of you are going to have Monday morning meetings in order to get to all of your clients and prospects. So if you have an appointment during this time, just please remember that we are recording these calls and they are hosted out on our YouTube channel. So if you type in Health Plan Markets in YouTube, you should be able to find our channel and subscribe there to ensure that you're getting the latest and greatest information from us so you don't miss out on what is next in this journey here as a healthcare insurance professional. That is what you are. So, all right, first things first. Remember, guys, we've got to keep one foot in the classroom and the other one in the field at all times. So I'm going to go ahead and share with you our training calendar. So let me move this out of the way. And looks like it logged me out. All right, give me 1 second here and I will log back in. There we go. Okay. So this morning, we've got a couple of rollouts. Well, throughout this whole week, we've got quite a few rollout sessions happening throughout your markets. So if you're in these markets, check out these health plans. Gold Kidney is doing their kickoff or their rollout in Boca Raton. So if you're down in that market, they're also hosting one tomorrow at 10 o'clock in the Miami market as well. All of this information is in the training calendar in HQ. So I'm not going to go through each one of these, but I do want to highlight quite a few of them. Those of you that are new to the Spark platform, there is a getting started with Spark at 2 o'clock today. That will get you up to date with all of the automated marketing and ensuring that your book of business is being marketed to throughout AEP at no cost to you, along with customer service support as well. Also, tomorrow, United Healthcare is doing their rollouts at 9 o'clock tomorrow. Make sure that you jump into that one. For Aetna, there's one at 11. But throughout this week, Spark's hosting quite a few trainings. There's one tomorrow at noon for leveraging your book of business with Spark, and then the call recording setup and the compliance regarding that. So you can sign up for those classes as well. Over on Wednesday, we've got our very own Al Clancy available to help you, coach you, and guide you on all things health insurance. So if you are lost, confused, in the dark, or just need a little bit of TLC, he's available every Wednesday at 9:30 to give you a little bit of love to help you move along in your journey there. So make sure you do that. Spark is hosting an overview of Medicare Advantage trends on Wednesday at 12. This is a good training if you're trying to get a handle on the market, especially if you've been in it a while. There's quite a few changes. We're going to talk about one of the biggest changes coming up this year for 2025, so you're aware of what's going on. And oops. And so, knowing what's going on as far as your trends are concerned is very, very important, so you understand what's going on there. Cigna's doing a couple of rollouts. Wednesday at 4 o'clock, you've got them at the back 9 down in Lakeland. They're doing that training. And then they're also doing one on Friday at 3 o'clock. So Marion County, if you're in the Marion County, Ocala market, Cigna kickoff is being hosted at 3 o'clock on Friday. Good way to end the week there as well. And then the last thing I want to point out is over on Thursday at 3 o'clock, HQ, which I'm going to go through again this morning so you can kind of see what's going on. HQ is our all-in-one a solution to ensure that you have everything you need in one place. So if you're not yet hooked up with HQ, which is our agent portal system, please shoot us an email over at support@askhpm.com. I'm going to show you some new features this morning to make your life as easy as possible as you go in through the rest of the week. So that is the training for the week. Keep one foot in the classroom and the other one in the field at all times. I will tell you this, there's a couple of special dates for us internally. Those of you that are familiar with Casey, it is her HPM anniversary today on Monday. So another year well spent at HPM supporting you guys. So if you bump into her or have her number, wish her a happy HPM anniversary. And then this Friday, August 30th, is Victor's birthday. So if you bump into the legendary Victor Cromedy II, he will be having a birthday on Friday of this week. So just some fun little things there. And also Sergio will be out on Friday. He had made it a point to put it on the calendar here. So don't go looking for him on Fridays. So, all right, let's jump over to HQ. A couple of cool things I wanted to point out. The team has been working very hard to prepare for AEP, and one of the major functions that we wanted to fix, obviously, is our communications and ensuring that we've got everything that we need for you to be successful throughout AEP. And communication is most important. So we realized we had some limitations in our help desk, our ticket desk, our chat features. So in order to improve that, we've installed a new system onto HQ, and you will see that it is live as of this morning. So here, if you have a question, you can simply click the button on the bottom right corner, and you can go ahead and begin chatting with us. Okay, so the new chat feature is there. It allows us to include all of our new team members. So if you're looking for someone specifically, we can triage your questions and make sure that they go to the right place. So that's the first part of it. The second part of it is if you're mobile, you can also leave us a voice message, which is a new feature for us. So if you just want to click here and leave a voicemail, you can record it from your computer, your phone, your laptop, or whatever. If you just don't feel like typing for whatever reason, we do ask for your name and email, but you can go ahead and leave us a voice call, which is exciting. The second part of that is this allows us to give you a phone call from HQ, which is pretty awesome. So I saw a demo of it. And so let's say you're on the chat and you have a very complex question, and someone from our team, it feels like it's better if we just talk over the phone. They can actually call you from HQ now. So your phone will ring or your website will ring, and you can actually pick it up through HQ, which is a really, really cool feature that we added this past week. So great job to Gabe and Fernando for getting this thing live. Also, the frequently asked questions is still being built out. We have some basic ones in there right now that kind of comes with the software that we're using. But the articles is something we're also going to be building out. So if you have suggestions for quick articles, please go ahead and send them our way. So right now, what we have in there is the care coordination programs for Centerwell, HRAs, how to add selling permissions, how do I become an agent, those types of things are being loaded in there as articles. We'll continue to build this out as we continue to go forward. So it's as easy as possible for you to get the information that you need to be successful. So please remember that right now we need to be focusing on recertifications. If this is your second go around or 20th go around, you need to recertify and make sure that you're ready to go for 2025. So best way to do that is you click recertifications under contracting, and all of the contracting instructions are here. Okay, if we're missing something, please let us know. We want to make sure that you're getting that information as often as possible. All of the trainings that I had mentioned earlier on the training calendar are located under Learning, HPM training there, and you have all the links to everything that's going on this week as I discussed it. Okay, so there was a few that I didn't go through, but you have the full spectrum right there. So HQ, if you don't have it, get it. If you don't get it, we'll help you with that. So please make sure you get that set up. You don't want to be learning how to use this thing in the middle of open enrollment is kind of the point that we're making. All right. big news on Medicaid and DSNP opportunities. So dual eligible special needs plans are changing with CMS. CMS is changing the fence or the guidelines around how we're dealing with dual eligibles. And I want to read this article that CMS put out on their fact sheet regarding the contract year 2025. This is part of the final rule that is still available. So if you need something really great to read and fall asleep to, this will do it. But I want to point out some key facts here to ensure that you guys know what's going on around Medicaid and DSNP opportunities, okay? Now, this isn't the full spectrum of what's happening here, so we're still going to be delivering some guidance as we get clarity on exactly what is going to happen around DSNPs and around Medicaid and Medicare plans, as well as the managed care around them. So I'm going to go ahead and read this to you, and then I will give you my 2 cents on what I think all of this means. So in this article here, if you scroll down about halfway, a little bit past halfway, there's a section that says increasing the percentage of dually eligible managed care enrollees who receive Medicare and Medicaid services from the same organization. Dually eligible individuals face a complex assortment of enrollment options. The rule will improve experiences and outcomes for dually eligible individuals by increasing the percentage of dually eligible Medicare Advantage enrollees who are in affiliated Medicaid managed care plans, as opposed to Medicare Advantage plans that differ from the enrollees' Medicaid plans. To achieve this, the Rule A revises the current Part D quarterly special enrollment period, SEP, for dual eligibles and other Part D low-income subsidy, LIS, enrolled individuals to a once per month SEP to enroll in a standalone prescription drug plan, and B, creates a newly integrated care SEP to allow dually eligible individuals to elect an integrated dual eligible special needs plan when the individual also receives Medicaid services through an affiliated managed care plan. Further, this Rule C limits enrollment in certain DSNPs to those individuals who are also enrolled in an affiliated Medicaid managed care organization, MCO, and D, limits the number of DSNP plan benefit packages an MA organization, its parent organization, or entity that shares a parent organization with the MA organization can offer in the same service area as an affiliated Medicaid MCO. So let me stop there. I want to kind of unpack what that means. According to this, CMS is creating a new SEP for individuals to switch once per month if and only if the member is on a Medicaid plan and that Medicaid plan has an affiliated DSNP product. So for instance, let's say you bump into a Medicare Medicaid member. They're on Sunshine Health, okay, which is the state's most popular Medicaid plan. They also have Medicare with no MA plan. You can switch that member in the middle of the year at any time, but only to WellCare because Sunshine is owned by Centene, and Centene also owns WellCare. Okay, so that's the way that it reads from CMS. So I'm going to go ahead and continue on this. Increasing the percentage of dually eligible Medicare Advantage enrollees who are in plans that also cover Medicaid will expand access to integrated materials, unified appeal processes across Medicare and Medicaid, and continued Medicare services during an appeal for those individuals. By reducing the number of plans that can enroll dually eligible individuals outside of the annual election period, the rule will also reduce aggressive, confusing marketing tactics toward dually eligible individuals throughout the year. These policies advance the goals of President Biden's historic Competition Council and executive order signed in July 2021, by promoting choice and facilitating improved access to an array of Medicare coverage options for individuals with low incomes. Okay. So the way that this reads is, and we'll have to get more clarity on this, but this may also mean that you can't switch from DSNP to DSNP unless that particular individual is within the same affiliated program like I had mentioned earlier. Okay. So changes are coming. The good news is the individuals that you bump into may have an opportunity to change once a month, but they're not going to be able to bump out to a different MA organization that's owned by a different parent company is the way that it reads. Okay. Again, we'll get more clarity on this as we move forward. But in the meantime, we should have a special guest on the line. Nick, I don't know if Joey's on the line from WellCare. Did he get our link?
Joey's here, my friend.
There he is. Joey. How's it going, man?
Awesome sauce, man. Thanks for having me today.
Of course, and maybe you can shed a little bit of light on what you guys know from WellCare, but let me go ahead and reintroduce the big boss at WellCare. Joey Anselmo is joining us from, it looks like he's driving, so be careful, buddy. And he's here to give us the big news on 2025 and what WellCare is preparing us for this upcoming season. So, Mr. Anselmo, take it away, buddy.
Hey, everybody. Thanks for having me. Joey Anselmo, Senior Director of Broker Sales for the state of Florida. I am on my way to St. Petersburg for my first AEP kickoff. Hopefully you received my email with all the invitations and locations and everything. And if you haven't, please reach out to your leadership so you can register for upcoming events. Orlando is looking like September 9, 16, and October 3rd, 2 events per day. Tampa has several events. We're all over the place. We got a lot of stuff happening everywhere in the state. Pertaining to what Justin just covered, wow, can they get things more convoluted for our members? It's ridiculous. But anyway,
yeah.
You have to have the same Medicare CAID company if you want to enroll somebody on a DSNP plan on Medicare. So fortunately, we're in a very good position. We just won the RFP for Medicaid from the state of Florida for every single county. And so some unknowns that I don't know is, well, what if a Medicare company has only Medicaid in certain counties? Can they only enroll people in those counties? I'm confused still on that one. Because like United and Aetna had to go back and rebid, and they got some counties, right? So I don't know what that means for that. But for WellCare, we can enroll people in every county in a DSNP plan as long as they are on Sunshine. So can people change Medicaid plans willy-nilly? No. They can change within 90 days when they're first auto-assigned to a plan. And then they can change, from what I understand, annually on their birth month. If anybody has anything contradictory on that, that's the understanding that I have for
me too.
Medicaid, right? And so you won't be able to say, hey, go switch your Medicaid, then I can enroll you. That's not going to happen unless they just have that ability to do so. So, excuse me. Still a lot of unanswered questions on that. The good news is we have 1 million Medicaid members in the state of Florida, and you can bet that at least 5% of those are duals. So interesting stuff. Part D, really interesting stuff going to happen. Fortunately, I guess I could say, they put out a demonstration product. Basically, CMS is saying, hey, you know what? Because it's an election year, we're going to pay a little bit more to the carriers, so the beneficiary doesn't have the burden of so much cost on the new Part D plan. But it's only for 1 year, so 26 is going to be another interesting situation for Part D. For WellCare, so LIS and partial duals won't have the opportunity to move during this time, only to a PDP and fee-for-service Medicare. It only applies to full dual eligibles that will have the opportunity to move. So a lot of stuff to absorb, a lot of stuff for you guys to learn, and you kind of be in a presentation and be like, whoa, what's going on, right? There's going to be a lot of times for that you're going to have the need to reach out to us, and we're going to be available. Obviously, I have a team of 11 now in the field, plus Carmen down in Lauderhill. So I have plenty of regional agency managers and myself. So we're going to be here to help you all the way through it. Good news for us on the core plans for 2025. We fixed the give back. We've really enhanced our benefits on the core plan, which is now not going to be called the no premium. It's going to be called the simple plan. I'm really happy about that. But we couldn't call it the no premium plan because what if we had to charge premiums on Part D, right? With all the new things happening, we had to make a move to do that. So that's where we're at with moving into 2025. I'm excited to kick off this AEP season today on the rollouts. It's my favorite time of year. I love getting in front of everybody and presenting. Again, if you hadn't had an opportunity to go ahead and register, please do so, because we want to make sure we have plenty of seating and meetings for everyone to attend. What else you got, Justin?
Well, I want to say, if you haven't been to one of Joey's presentations, you will walk away with at least a couple of laughs. I will tell you that he keeps it lighthearted, and it's always a great time. You won't be bored out of your mind. So if anything, go for the entertainment, but stay for the information, So yeah, man, you have plenty of war scars and medals of honor in AEP. So this is probably the most, I don't even know how to describe it. Just a perfect storm of craziness happening in this business. And so, I know that you have been out there selling a long time ago, but if you were to go back and we're in these guys' shoes, hold on, had somebody yak in there. If you were to go back and say, hey, I'm going to go out and sell, or if you were in these guys' shoes, what would you be doing right now to prepare for AEP? And what would be, off the cuff strategy for Joey Anselmo?
I'd open a lawn care business.
No. Hey, I'm open to that, man. Let's talk.
No, honestly, it's going to boil down to you being the person in your community, within the doctor's offices that you work with, within the food banks that you work, wherever you're working in the community. You've got to make yourself available, because there's going to be so many questions. There's going to be so much shopping going on this year that your professionalism and the information is going to be key to helping out all of your seniors. So you want to make sure you've got everything. It's really, really important. And, the beneficiaries need you this time around more than ever. It's just not going to be a matter of, hey, I got this, you're ready to go. It's a little bit more this year. You're going to have to really dig deep and make sure their drugs are covered at a reasonable price with a reasonable deductible and all of those things. So please, make sure that you are available to your book and available to the new folks that you run into. Sorry, I'm getting honked at.
Yeah, no problem. So the big thing, guys, and what Joey's alluding to is you have to stay ahead of everything. You have to continue to learn right now on all the changes that are happening. You got to be on your toes, and that's the purpose of these calls. So if you notice that some of your colleagues are not joining these calls to get the most up-to-date information, please encourage them to be here. Go out to these rollouts. If there's any year that these rollouts are most important, it's this year.
Yeah.
I guarantee you that you will go to these rollouts and you will take something away. It's not like it used to be where it was, puff and fluff and all that. This year, you're going to take away some good nuggets of information that are really going to help you excel in the field. So you can't help other people if you don't know what the heck you're talking about. So that's the biggest thing. So if you're lost, confused, or if you need help, reach out to these guys. Like Joey said, he has tons of sales managers that will keep you ahead. Let's talk about retention, Joey. This is a year where they're saying, an average year, 20 to 30% of seniors will go out and shop. And this year they're saying it's going to be over 80, maybe even 90% of seniors going out and shopping for a new health plan. How nervous would you be as an agent if you had a significant book of business, and what would you be doing?
Oh, I definitely would be nervous. And, starting in a couple of days, I would definitely be reaching out to my folks and letting them know that you're the source, that you're the person, that there are going to be changes, that you're going to want to have information. And please, I mean, you're going to need to do a lot of preservation with your book because there's going to be so many people out there. It's going to be unbelievable the things that are going to be out there for people to make phone calls to someone else, right? So you've got to solidify your relationship with your book. Make sure that they understand that you're the only resource that they have, and everybody else is just blowing smoke. I don't want to say it like that, but you've got to be that person for your book. Otherwise, they will shop. If you're not in touch with them, they will find somebody. So really, you got to start in September, making sure that they know that you'll get with them and you'll make sure that they have the coverage that they need. And so we don't want them to, wake up on, January 1 and go to the store and then not have coverage for what the prescription drugs they need. So super important that we make sure that you solidify those relationships with your book and that they know that you're the person, that they have your number, they have your contact information, that they can text you, that they can do anything, right? So be that professional for them.
That's great advice. And you brought up another point. Not only will this AEP be very, very busy, but we anticipate that OEP, January through March 31st, is also going to be very busy because maybe people didn't move to the right plan, or maybe they just didn't make a move. And now they, like Joey mentioned, they're going to go to the pharmacy, they're going to go to the PCP, they're going to go to the hospital and get smacked with these high copays that they never had before. And if you're not out there, if you're not in front of them, you could lose them to your competition as well. So just a mental note to yourself, you should be gearing up not from October 1 to December 7th. You should be gearing up from September 1 until March 31. So, kiss the kids and the wife and your husband bye-bye, and we'll see you in April. But that's all good because you're going to come home with a really big check. Try not to lose focus on that. I think that, plans like WellCare are going to win big, especially with this DSNP opportunity. And Joey, and kind of to shift back to WellCare, I'm getting some questions in the chat because WellCare released some information recently about non-payable commissions on the PDP plans in 2025. And there was some confusing information about, are they going to, initial payments versus renewals? Can you shed some light on the PDP situation with WellCare?
I'd love to. Really unfortunate situation of events that happened here puts us in a really tough spot. We filed. If I can explain what happened, it'd be really helpful, right?
Yeah, please.
With final rule, we filed benefits and our intent on commissions on June 4th, to not pay commissions or renewals. July 3rd, that was put on a stay by the courts in Texas. And when we went to refile, they would not allow us to adjust. So that put us in a spot where, oh man, right? So I'm going to push a little of that on CMS, fault, but it's really tough, man. It's a horrible situation. No commissions, no renewals for 2025. Digging in a little bit deeper to find out what really that means to your book of PDP clients. Again, this is nothing to do with MAPD. It's PDP only.
Got it.
So what does that mean to your current book of PDP clients? you won't be certified with WellCare in 2025, so you can't offer it. So it's a little bit more to come on that, and I should be have more clarity at the upcoming kickoffs as we move forward with that. But the unfortunate situation is no commission, no renewals for 25.
Okay. So we anticipate that you guys should be able to fix that for 2026 because it was a snafu based on CMS's information about how that they were going to require compensation for the PDPs initially, and then you guys corrected course, and then they got, then they reverted, but it was too late for you guys to revert your decision on the commissions.
Well, they wouldn't make us make any change because we were able to make commission changes, but we were not able to make plan changes that would balance out the book. You see what I'm saying? And
absolutely.
That's where we came into a situation with CMS. I really thought we were going to court over it, but it just didn't work out. And hopefully something possibly happen between now and October 1st, but I'm not hopeful at this point.
Well, I see a silver lining in this. If agents have a significant WellCare PDP book of business, and knowing that you guys are swinging for the fences on your MAPDs this year, this is a great opportunity for you guys to open up that WellCare PDP book of business and see if these members are eligible to switch, or they're going to be eligible. It's just, is this a good fit for them to switch to an MAPD product? So you can become compensated a lot better, by the way, than a PDP product, and then get them into the full product line with WellCare. So it's a good opportunity for those people that are paying attention to what's going on.
Yep, definitely.
And there was another question here, and I'm pretty sure I know the answer to it. It says, is there a new contract that needs to be signed with WellCare to receive MAPD commissions?
It's a good call.
Is there any?
You've completed your ACT and you completed your AHIP or NAPIP, whichever one you did. And when you go into Centene Workbench, it still says that you're not certified for 2025 yet. And that's because of the 2025 contract hasn't been published yet, because we want to, it's all in legal right now, making sure that we have all the components of final rule in there. We had to redo the whole thing. And so you won't be 2025 certified until you sign that, what we call TPME. Basically, it's the contract for 2025. Once that does get signed, however, not published yet, but once it does get signed, then you will be 2025 certified. If you're new to WellCare and you did those certifications, you're still eligible to sell for 2024, but not 2025 certified yet. Okay. When that gets published, I will let everybody know. I'll send out a broadcast note just to remind you, but you will have to go back into Workbench and sign off on that TPME, third party marketing entity agreement.
Awesome. Thanks for clarifying that, because that is something that was overlooked. I think you guys did that last year, the year before as well, and we got a lot of confusion from that. So awesome. I know you are super busy, my friend. You're on the road. I want you to be safe and careful out there, because you are a diamond for us. Thank you, man. We really appreciate all of your time and attention today.
My pleasure. Thanks for having me. Anything I can do, team, please feel free to reach out to myself, anybody on my team, and we're here for you all the way through it. And anything, questions, just send a text, give me a call, whatever it is. But have a great season, man. I'm really excited for this year.
Me too. Thanks, Joey. Appreciate it, buddy.
Good day, everyone.
All right, be good. All right, everybody. I posted Joey's email in the chat there. So if you do have any questions regarding WellCare, if you need help in your market with WellCare, Joey can connect you with the local sales managers there to give you a shout. He's in charge of the entire state of Florida. If you're outside of Florida, or if you need help outside of Florida, he can definitely connect you as well. So don't be shy about that. So we are at time. I am very grateful for everybody to be on this call. I know there's lots of changes. This is another reason why you got to stay on your toes and be here every Monday so we can get you the information early and often. Thanks again, guys. I hope you guys have a fantastic week. Go ahead and close the month out strong. It is closing week, which means that you got to get all of your September 1s wrapped up and out the door and start thinking about AEP next week. All right, guys, have a fantastic day.